Now, this is a very interesting messaging because we can very nicely see that there is a block. So when we see that we can see P wave here, P wave here, P wave here, but there is no QRS in this area. So we can come to know that there is sinus bradycardia. We can simply calculate the heart rate by calculating number of large square as well. Like this one is a one large box. This is one large box. This is second. This is third. This is fourth. This is fifth. This is sixth. This is seventh. So we can simply calculate by 300 divided by number of large square, that is 7. So the heart rate is around 42. So heart rate is around 42. Patient has bradycardia. Patient is having some P waves, but there is no QRS. So as per the rule, we know there are three types of blocks: type 1, type 2, type 3. In type 1, there is always PR prolongation, but QRS drop is never there. But in this case, we can see that P is here, P is here, P is here, but there is no QRS here. So QRS drop is here. It means it is not type 1 heart block for sure. Now when it comes to type 2, Mobitz 1 and Mobitz 2, what does Mobitz 1 say? That there has to have PR prolongation. PR prolongation is there, which is followed by QRS drop. So there is gradual PR prolongation and there is QRS drop. This is Mobitz 1. And what Mobitz 2 says is the PR is constant and there is QRS drop, that is Mobitz 2. So in here, PR is definitely varying. PR is not constant, PR is varying. So this is definitely not Mobitz 2. So we have already ruled out type 1, Mobitz 2. Now only remaining are two, that is Mobitz 1 and complete heart block. So let's consider this as Mobitz 1. So in Mobitz 1, there has to have progressive PR prolongation. Now see here, here PR is here. Here PR is prolonged and then there is drop. We can consider same scenario here, that PR is around 5 small boxes, 3 to 5 small boxes, then the PR has prolonged and then there is drop. So on saying this, we may think that this is Mobitz 1. Here also the PR is almost like 5 small boxes, then it is around 10 small boxes and then there is drop. Here PR is almost 1 to 2 boxes only and there is sudden drop. So this is unusual. So the most important rules always which we need to understand or which we always need to learn is in Mobitz 1, PR prolongation is there for sure. There is gradual PR prolongation. But the most important thing is PR should have some baseline value. A PR segment should be at least like uh, 3 to 5 small boxes, because less than this is usually we consider it as short PR, which is unusual. So baseline PR always has to be fixed and that should always prolong. So in this case, we can see there are total 5 boxes. So what we can consider is this is actually the baseline PR. But what happens here is PR is not at all there. P is directly coming with QRS. So this is unusual. This is not normal PR complex. So what does it mean? This there is no PR prolongation indeed. It is just that P and QRS has no relation. They are simply coming in between as per their convenience, which is what is we call it as AV dissociation. Means the QRS and P they come at their own pace. Means atria and ventricles They don't have any connection. When PR is prolonging or when PR is connected, then only we can call it as that atria and ventricles, they are connected. But here this PR is so much short. It is so much short that this is not a normal PR. So we cannot consider this as a valid QRS or valid P followed by QRS complex. It means that this P has come suddenly without any direct correlation with QRS. So this is typical AV dissociation. The second clue is here. If we can see P is here, there is one more P which is embedded here. We can very nicely see there is notch. There is a clear cut notch, and this is P. So if we can calculate the distance between the two P, so this P has occurred here. This is one box, two box, and three box. At a large boxes, we have seen P wave interval, and if you see here, there is one box, two, and exactly at three boxes we are getting the P. So P wave rate is constant. It is coming at the rate of almost 100 beats per second. P rate is constant basically per minute. So here the PR didn't prolong also, and there was drop in QRS. There was no QRS here. So it prolonged, and then again here we could see a drop bit. So in basically here there is no PR prolongation, means in this ECG there is basically PR prolongation looks apparent, but PR prolongation is not there. There is drop in QRS even without prior PR prolongation. There is presence of P without prior PR prolongation, and P and QRS, they are so much indistinct, or they are in so much discommunication that there is no communication between atria and ventricle, because this PR is not at all justified. Hence, this is not Mobitz 1, this is basically complete heart block. And heart rate for complete heart block is almost always around 40. And this is ECG, the heart rate is around 40, which completely fits the picture of complete heart block. So thanks for today's class. We'll meet in the next class.